Welcome to TRS Healthcare. This is the story of TRS Healthcare. TRS stands for The Right Solutions, a play on our founder's name, Dr. Diana Wright. Chapter 1, Company History. Where did TRS begin? It was started by an RN in a strip mall. The Right Solutions opened November 1st, 1996 as a per diem nurse staffing agency in a one-room office on a strip mall. The first shift worked was at Eureka Springs Hospital in January of 1997. Dr. Diana Wright is the founder, owner, and president of TRS Healthcare. At the hospital she worked as an RN, she would coordinate with other nurses to fill scheduling gaps. In the early days, Diana worked the shifts herself when she couldn't find a nurse to work. Noticing a wage gap in Arkansas, she challenged her facilities to pay nurses what they were worth or equal to those in Oklahoma. They laughed at her. Diana took every nurse she could from Arkansas and assisted them gaining licensure in Oklahoma. She then sent them to work there simultaneously and caused a nurse shortage in Arkansas. Diana, cognizant of patient care, reached out immediately and negotiated a fair wage increase for her travelers. She then sent over her Oklahoma nurses she had quietly been getting licensed in Arkansas to save the day. Noticing how hard she had fought for them, Diana had been a hero to regional nurses ever since. Working from a tiny room with a Rolodex, a phone book, and a dot matrix printer and corded phones, Diana began to staff her own travel company. She found Robin Clark working as a certified nursing assistant and asked her to come aboard. Robin is celebrating her 20th year with the company now. The Right Solutions grew and grew across the nation, hiring more and more nurses every day. When the economic downturn hit, TRS was debt-free and economically viable, and Diana had planned for it. She promised that if her employees chose to stay with her, she would make sure they had a job and that their families would have food on their tables. After surviving the economic downturn, Diana was diagnosed with stage 4 cancer and given 8 months to live. The year was 2012, and she was working 60 to 80 hours a week. During her battle, she established Taylor Fott, her son-in-law, as her successor to take care of her company, ensuring that it would live on strong and successful long after she was gone. However, Diana won a hard battle against cancer by changing her lifestyle and using naturopathic methods to kill off the disease. She still retains her role as president, helping others with holistic medicine. The Right Solutions eventually became TRS Healthcare with the addition of Connexus as an MSP. TRS Healthcare is one of the top 20 best travel nurse companies and named one of the best places to work in 2017. Diana has 30 years of experience working as a registered nurse. Her experience guides TRS's policies and principles. We advocate for our healthcare providers and understand the difficulties and rewards a healthcare career can entail. Diana's goals are embodied in the service TRS offers: to provide rewarding opportunities for our hardworking healthcare professionals that is equal in value to the service and sacrifice they provide their patients. She was named Best Nurse of the Year in 2015 due to her commitment to comfort and restore lives. Today, TRS is made up of different departments that work together to help nurses become healthcare professionals who travel, experience new cultures, and build their resumes across the United States. Chapter 2, Company Overview. So how does TRS Healthcare transform nurses into healthcare professionals? To get a healthcare professional in the door of TRS and out working for the facility takes an army. In this case, it's the TRS Army. The recruiter's role at TRS Healthcare is to prospect and call nurses to fill the positions that are available. In doing so, the outcome is working healthcare professionals. The recruiter is the main contact person for that nurse. The recruiter will create value for a healthcare professional with positions, pay, locations, benefits, and overall be available for their healthcare professionals should a situation arise. The account managers at TRS Healthcare are responsible for communicating with the facilities and posting the positions. They also work closely with management service providers, MSP, and vendor management systems, VMS. You will learn later what that means exactly. The account managers will work alongside the recruiters in pushing the profile and finding the perfect fit for the healthcare professionals. The role of the profile coordinator is here to make sure the online profile or resume looks perfect. In doing so, they communicate with the healthcare professionals in making sure we have all the required information that the facilities are looking for, such as work history. We want to make sure nurses don't have any work history gaps and that the specialties that they are working at each facility are clear and up to date. Profile coordinators verify certifications, active state licenses, call references, run background checks, and overall clarify and verify that the profile meets all the requirements needed by TRS to be an eligible healthcare professional in our system. PC works along with the recruiter. Credentials role at TRS is again a very important role. They are responsible for the healthcare professional's credentials when they are going on an assignment. This means when the healthcare professional has accepted an assignment, credentials will audit the facility and the profile of the nurse to see what all is needed. This can be a daunting process for the healthcare professional, especially if they have never traveled with us before. Credentials will follow timeline requirements and communicate that to the healthcare professionals. Credentials will also send out first day instructions when they have been cleared to start the assignment. The housing department at TRS matches healthcare professionals with 3 to 5 options based on their needs and the location. Housing is customized based on the needs of the healthcare professional if he or she has decided to work with TRS to find their housing. Risk management is responsible for issues that the nurse may encounter while on the contract with TRS Healthcare, basically a clinical liaison. They will review profiles when needed if there is a question, such as if a healthcare professional can work during their contract when there is a concern that could compromise their contract. Accounting at TRS is just that. They are responsible for getting all paycheck instructions, time clock requirements, and paycheck questions. Anything to do with the healthcare professional's pay, they take care of. TRS's IT department is top-notch. Our system is all designed in-house and far beats out our competition. They are always looking for ways to make it easier for all in-house staff as well as our healthcare professionals. If you have a technical issue, you simply send your manager an email describing the issue, and they will put in a help desk ticket to get it resolved. Connexus is a sister company to TRS Healthcare. They are a management service provider. What does this mean? It means they work directly with the facilities and provide profiles to the facility from 50 other agencies just like TRS. This helps the facility because they are speaking with one contact at Connexus versus 50 contacts from 50 different agencies. This is also designed to help grow TRS. As you can see, everyone here has a defined role in getting the nurse working, which provides help to the facilities that are short-staffed and in turn provides patient care to those that are sick or injured. Everyone here plays a viable role in making this happen. So with that, it's important that we all communicate effectively and work together. Let's talk about how the TRS departments work together to transform nurses into traveling healthcare professionals on contract with TRS Healthcare.
The contracting process at TRS Healthcare begins when a hospital is short-staffed and is looking for nurses. A TRS account manager is then notified that a facility needs nurses and the specialties that they need. Next, recruiters actively search for prospects that fit the criteria. After a qualified traveler is identified, their profile must be completed and sent to the hospital. Then the hospital holds a phone interview with the healthcare professional if they are interested in that candidate. If the hospital finds them to be a good fit, they offer the position to the traveler, which the traveler can accept. At this point, the traveler is officially hired, and the last step is completing compliance and onboarding. In summary, a hospital is short-staffed and needs temporary help. An account manager at TRS is notified. Recruiters actively look for prospects to fill the position. A qualified traveler is identified. The completed profile is sent to the hospital. the hospital or facility calls the traveler for an interview. Offers the position if the candidate is a good fit. The traveler accepts if he or she is interested. The traveler is then officially hired and completes compliance and onboarding with TRS Healthcare.
Now that you have been introduced to the various departments at TRS, let's talk about some lingo you will pick up here. HCP means healthcare professional, and it is interchangeable with nurse. The training modules will usually refer to nurses as HCPs. Travel Pro is our in-house software for keeping track of our HCPs across the company. It helps us prospect, profile, and submit HCPs to positions. PC means profile coordinator, or a person in the profile department. MSP stands for management service provider. AM stands for account manager. And VMS stands for vendor management system. If you hear any other unfamiliar terms, don't be afraid to ask. Every company has their own vocabulary. What makes TRS Healthcare one of the top 20 traveling nursing staffing companies? We have a competitive advantage to our competitors because of our strong features and benefits. It's important to know what your company offers, so watch this short video about our top 10 features. TRS has a variety of benefits to the nurses we serve. We are nurse-owned and operated. We have been in business over 20 years. We create new career pathways, provide a travel allowance on every contract. We have a nurse service guarantee. We're large enough to be competitive, but small enough to treat you like a nurse and not a number. We are Joint Commission certified, and we are the dominant agency in the Midwest. We have a housing department that will personalize housing needs. We also offer a no haggle pay and the best pay from the start. We live by the motto, you are a nurse, not a number. Let's get started. Welcome to the TRS Training Portal.